Dr. Meaghan, good evening. How you doing?
Good. How are you doing?
I'm doing well, although, it's only dinner time and it feels like it's the middle of the night with these short days. I know we were talking about that offline a little bit, but other than the fact that my body is trying to wind down for the evening, I got my blue light blocking glasses on. I'm awesome. Really happy you're here today. Thanks for being here.
Well, I'm very excited to join you and to talk all things hormones and everything else we end up talking about, just about functional medicine and holistic health.
I can't wait. I mean, we were just at your facility recently for Dr. Eric and Dr. Kelly doing the live, thyroid debacle lecture. And you have one of the most beautiful facilities I've ever seen up in Minnesota. I highly encourage anyone who listens to this, if you want to go check out someone who's doing it right, please take a trip up to Minnesota. Maybe in the spring, the summer. I don't know if you want to trundle your way there with snowshoes on. But yeah, you have a beautiful facility. And
Thank
we
you.
did get to hear you speak about your passion, your expertise, and your specialty, which is hormones. So the second question I have about what we're going to talk about today regards hormones. The first question I always want to ask is, who are you? What's your story, Dr. Meaghan? What brought you here to this moment today?
So I sort of started actually more in the traditional world. I have my nursing degree and my chiropractic degree, and then have continued on into nurse practitioner and have one both in women's health and family practice. But really, from the way I practice to even my education, I just believe that we are most powerful with the most tools in our toolboxes. And I really do like both worlds of traditional and more alternative medicine. I think they do have a good place in the middle. Obviously, in the last couple of years, I've seen a lot more power and strength and have gone a little bit more towards alternative. But I think when we put it all together, I think to be strong providers and practitioners, we need to really educate ourselves. We need to, like I said, have as many tools as we possibly can in order to really give what our patients need, which is a lot of different answers. And not every patient or any patients are really the same. And so education-wise, I have really tried to be sort of a broad scope in my practice. And then at the practice that I currently have called One Agora Health in Bloomington, we offer everything from chiropractic care. We do a lot of modalities like soft wave. We do a lot of energetic work from microcurrent, AccuScope, also do the biocharger. We do cold plunges. We just have a really big range of services that we provide, because when we look at how to get people both back to optimal health, but to keep people healthy, we have found that it really takes a village. And it takes a village of good providers, and it takes the village of treatments. And it definitely takes a village of education, because even though I have stopped gaining degrees and I'm happy with the ones that I have, it's constant learning and just learning all the time in order to get answers for my patients.
Well, things in health, they never stop. If you're standing still, technically you're moving backwards. Stagnation never helps anything. I am curious, did you have a health story, or what was your inspiration to get into the world of being a healthcare provider?
So there's sort of two things that drove me is I did have hormonal issues when I was young, nothing serious, but was sort of thrown. My dad's an oncologist, so I was thrown into that traditional world. And at 18 years of age, a doctor looked at me and pretty much told me I was crazy because I was having hormonal issues and I didn't want to go on birth control. I just didn't want to just add in birth control. And I don't remember, honestly, at the time, if I just didn't want to take a pill every day, or if I just was like, there has to be another reason. And I still remember the doctor looking at me like, okay, you're taking up my time. You're wasting you're wasting my time because you're just not doing my solution of birth control. And I then went into undergrad and started out as pre-med. Didn't last actually very long in the pre-med world because I was like, I don't know what I would do coming out into the world as a traditional doctor. So I then moved towards nursing and knowing that I was going to go into holistic healthcare more with chiropractic. And then as I've evolved, have gone into more obviously the nurse practitioner too, to mold both worlds. But it just came from at 18, sort of having that insight into the fact that there had to be more answers out there. And then as I started to get into healthcare, my first job was on organ transplant as a nurse. And we were giving such false information. I mean, these people were coming in needing kidneys, pancreas, and auto islet transplants and needing, new organs because and a majority of our patients were diabetics. And I remember them hearing patients say time and time again, I can't wait to drink my first Coca-Cola. I can't
No.
wait until I can eat cookies again. And I remember one patient that I was talking to about it, and I was like, well, have they talked to you about dietary changes? And they said, yeah, my doctor said I didn't have to make any dietary changes, that, I was getting a new organ and that I was on insulin, so I was fine. And I just thought to myself, like, this doesn't make sense. Like, why aren't we putting both things together? Like, we can do great things with the latest and greatest with organ transplants, but why are we telling these patients to keep the same lifestyle going? And why are we telling them that they can continue to drink Coca-Colas and eat cookies when we could give them so much power by molding both things together? And so it was just all of those little things adding up to realize that the answer wasn't in traditional medicine, and that we had really missed the boat by, we were just trying to figure out the ill and give them the pill or the transplant, and telling them the last thing you have to do is change your lifestyle. And then the other thing that's just really stuck with me is having a dad that I've worked with in oncology, that cancer patients, it's just crazy to me that we sort of view cancer as bad luck, and he will talk about this all the time too, is that he doesn't have the tools and the resources to sit in front of his patients and say, okay, well, let's figure out why you get cancer. They're just sort of taught in the oncology world that it just happens. That yes, there's some genetic components and BRCA genes and things like that, but at the end of the day, it's just bad luck. But the sad part about that is that it doesn't give the patient power. That if you feel like this just happened because of bad luck, then you don't have the tools to say, well, what can I change to feel empowered again? And I think health is really about empowering the patient. And, that's really one of my big goals as a provider, is how do we give the power back to the patient and give them back control of their body, whichever, tool or resource we need to do that.
I think that's incredibly well said. Just the simple fact that, you can have the perspective of looking at an organ like a car tire. Like, yeah, you wore a set out, just like, let's do the same thing with another one. Or cancer, like, yeah, there's nothing that you did to create this. So no, there's nothing you have to change after you go through your rounds of treatment. I mean, we could talk about the broken aspects of the medical system, because I love to hear the perspective of someone who's really been on both sides. I do believe that there is this divide, there is this combative allopathic versus whatever you want to call the other side. The alternative is, it doesn't encompass everything sometimes.
Yeah.
But it's really cool to hear those perspectives, and then also hear that your father, who is an oncologist, a very high-ranking official in the health world, is saying, I wish I had more tools in my toolbox. I think that alone is going to start waking people up to taking responsibility for their own health, understanding and being more educated. So they're going to force, traditional health practitioners to maybe have the awakening aha moment you did, and learn to collaborate, the best from both sides. Thank you for sharing that. I know hormones are your jam. I know we got to get into that. I want to ask you a question. I don't know if anyone's asked you this question in this way. How do you relate to hormones? What is it about hormones that grips you? And how would you explain hormones to someone who really wants to understand your perspective?
Mm-hmm. Well, it's interesting because I do think that it's a little bit easier, and no defense, but I think it's a little bit easier sometimes for women to connect to women with hormones. But I also think that a lot of times, like when men come in and want to talk about testosterone, I do think a lot of them prefer to talk to a male. But I think that, like, my own journey of knowing something was wrong with my hormones, and I was sort of the generation where they started to hand out birth control like it was candy, and it became it was crazy. And I remember so many of my friends absolutely loved it. Like, I remember friends pretending they had bad periods so they could go and get the birth control and not have to talk to their mother about sex. Like, it was this just huge wave of, like, okay, now as a doctor, their job became a whole lot easier. But being in the hormone world too, I have just been floored how much OBGYNs, and again, no disrespect, know nothing about hormones. Like, I will have patients time and time again have hormone issues for 10, 20 years. And, like, nobody has sat down and talked to them about the hormone cascade, even about what estrogen does and what progesterone does and how they need to be balanced together. And when you go to an OBGYN, they might run blood work, which blood work isn't a great indicator, but they might run it. But the majority of them will say there's no reason to run it. So they don't even look at hormones. They don't even look at those levels and look at how all of it's correlated. They just say, hey, if you're having problems, go on birth control. And if that doesn't fix you, or if that doesn't at least get the symptoms better, then, they are out of any kind of option, but they're definitely not looking at how everything's balanced out. So when I started to, look into this, and then just along the way, I've obviously had a ton of like patients from infertility to PCOS to coming off birth control with a bunch of side effects to coming off birth control and having to deal with the initial problem that might have put them on birth control because it was never addressed. That realizing, like, when we have these great tools like Dutch tests and saliva hormone tests and ways of being able to really get into individual pathways for each person, that then when we balance these out, we can help to support not only the hormones, but we also can support all the other endocrine glands. We can support the immune system. We can support the nervous system, because the nervous system, hormone system, and immune system are in such close talking quarters to each other, and their communication for all three to work really depends on the balance of all three systems. And so, it's just been over time and experience with patients that really then looking at people's hormones and realizing not only can we look at them, but then also sitting in, I do a ton of education with patients. I always tell patients, I might bore you with my education, but I'd rather you understand how this works. And that this isn't me saying to you, okay, we need to do this. You need to take this supplement, you need to take this, bioidentical hormone. It's for you to understand, because then we can also talk about lifestyle. And when you make those changes with what we do, then again, that empowers you.
Oh, amazing. So in that, you said something that's interesting. You said the word balance. And when I think of hormones, I think hormone balancing, I think allopathic medicine. You can go to various hormone clinics, and their goal is to give you testosterone or estrogen or progesterone. And the way I see that is, if the hormones are off, then the body has lost the ability to communicate with itself in some way.
Mm-hmm.
And replacing them may, it's like robbing Peter to pay Paul. It's not necessarily a solution. You might feel better, but what happens when you take those things away? So if that's the allopathic methodology, which is very much in a silo, what's your take on the concept of hormone balancing, which is a very generalized statement? What is hormone balancing anyways?
Well, I think it always has to start with looking at the person's specific pathways. Yes, you can do some of this through questionnaires, and along the way, there's been times where I've used questionnaires, but there's so much intricacy in hormones that I tend to always do some kind of test. And by far now, I have gone a lot to the Dutch test, so the dried urine, comprehensive hormone test. And that's the reason is because a woman can present with very similar symptoms. A lot of times I might think that a woman just is really low on progesterone, but she might then be normal on progesterone, but high on estrogen, because it's really, that ratio between progesterone and estrogen. Sometimes a woman might be, lower on estrogen, but really, really low on progesterone. And so when you look at all of that, then you've got to put it all together on how to balance it out, specific to that patient. I also see a lot of women that'll come in where it's their pathways. And so, the Dutch test does break down what's called the 16 hydroxy to 4 hydroxy to 2 hydroxy pathway. And so then you've got to support pathways like methylation, glucuronidation, and just detoxification in order to get things balanced. And so no woman or man is, I think, you can decipher what they need just off of, talking to them, unfortunately. And now today, more than ever, with as much hormone mimickers and endocrine disruptors that we have, there's just so many things that go into it that the more information you have starting out, the better. The other thing I want to say is that a lot of these clinics, what they do too is like, they'll have, especially women come in and they'll give pellets, but they're giving the same dose to every woman. They're giving the same estrogen, the same progesterone, the same testosterone. And they're putting it in for 3 months. And if it doesn't work, then they might change it. But I think that's a really lazy way to practice, because at the end of the day, a lot of people don't need all the hormones. They need a balance. And so, but you have to do the actual detective work to figure out what balance they need, because it's not the same for each person.
What it sounds like you're saying is balancing isn't just looking at the quantity on a blood test and balancing the reference ranges of those to where you would want them on paper. You have to think about the other side of the axis. You got to think about how it's getting out of the system. So balance is really the influx and the efflux, the in and the out. Is that a fair way of putting it?
Yeah, exactly. You've got to look at, what are you making? What are your levels at? What are, endogenously, what do you have in? And then what are you able to get out? What are you able to process? And then it's actually too a lifetime story because of the fact that if you've over the years, like with birth control, really pushed for higher estrogen and you're in what a lot of people call estrogen dominance. I a lot of times refer to it more as like estrogen chaos and confusion because it's interfering with everything. But
Mm.
you know, when those kind of things occur, then that's really where you've got to look at that person individually and see then how do we start the balance out. The other thing is that sometimes it's a whole different underlying cause like candida. So there can be a yeast or candida issue. And so there's certain markers like on Dutch test, the pyroglutamate will give me somewhat of an idea if that's something we have to look into. But if there's a higher yeast that's producing more byproducts like acetaldehyde, which it produces, it interferes then with our detoxification system. So we've then got to clear the candida, help the detoxification systems, and then get everything back on board. I know it seems complicated, but when you start to work it out and really be able to put together these, you know, different components and start to plug it into the pathways, you really start to realize like you can make a huge difference and give somebody back that support and that foundation that's needed with hormones.
Sounds like a simple balance sheet. I don't know what she's saying.
I know.
That was a really amazing explanation. It left me two things to ponder there in terms of what to ask next. I'm going to come back to the thing that just came in my mind because I want to go on the original track. So in saying that, knowing it's an in and out, and you're seeing patterns of what you're measuring, and then you're seeing patterns of what may be inhibited, what are things that are common trends that you're seeing clinically with the patients that you work with?
So by and large, like especially over the last like 10 years. So I've been in practice for about 18 years. And so I'm doing more of this alternative holistic practice. And so for the last 10 years, I've definitely seen women with a lot more estrogen. Also, I see some women, even some women in their 20s, just come in with low progesterone. And one of the reasons that, you know, I think we see this is because if you're on birth control, some people don't even realize the simple fact that what birth control does, which you alluded to this a little bit, is it stops the communication between your brain and your ovaries. You know, and there should be this constant feedback of your brain telling your ovaries every day, you know, what to do with the estrogen and the progesterone. And during the cycle, that's going to be completely different. And so what you're doing with birth control, you're sort of just overriding it so that your brain no longer has to talk to your ovaries. And so that really then a lot of times can suppress progesterone production. And so I'm seeing, for the most part, high levels of estrogen, low levels or high levels of estrogen and low levels of progesterone. I'm also seeing a lot more women in the PCOS spectrum. And so, you know, polycystic ovary syndrome tends to have higher DHEA, higher testosterone, lower progesterone, and has a connection to insulin concerns. And so I am seeing more and more women that might not be that, you know, complete PCOS person that's like textbook, but coming in with those patterns. And so if we can identify those patterns earlier, then we can treat them earlier and be able to really balance them out. So I'd say those are ones that I see pretty regularly now.
And we're still talking about, you know, measurement values here. We're seeing what the tests are coming back. What are people experiencing as kind of like a symptom set or an experiential aspect of what these things can, you know, promote in the body?
I mean, so honestly, when hormones go off, I mean, it really can, and it can be a chicken or egg. Like I have a lot of people that come in that are primary hormone issues. And so it's the hormones that went off first. And I definitely have a lot of people like my Lyme and mold patients, and then some of my thyroid patients and other patients that hormones have gone off because of the other component. And so I always say estrogen is sort of, I am woman, hear me roar. Progesterone is sort of, I'm that nurturing, calm woman. And so sometimes we give this, you know, thought process that estrogen is bad and progesterone is good. And that's not necessarily true. It's just that they have to be balanced. We have to sort of be that nice combination of I am woman, hear me roar, but I'm also nurturing, calm, and, you know, collected. And so when they're out of balance, then you just feel like you have no control. So you will feel very irritable. Obviously, a lot of times you can even see like temperature dysregulation, brain fog. It's just disconnected from every level of the spectrum. To some people, honestly, feel like they're going absolutely crazy, to just feeling like they have no control of their day. I've seen truthfully a lot more hormone problems and concerns too since COVID. That's something I'm very happy to talk about because I've seen it and I think we need to have discussions about it. So, there has been research that the COVID protein has an affinity to certain tissues, and one of them is the reproductive tissues and the ovaries. And so I have seen, a lot of women have bleeding dysregulation that they've never had before since COVID. And so, that's sort of been the last 2 years of trying to help figure that out too.
Wow. And what in that are you finding, and what potential breakthroughs or solutions have you come up with?
So we have a pretty good regimen that we've had good success with. So I do a lot of castor oil packs and have them do them, lower down on the reproductive organs. So castor oil does a great job of helping, I think, not only to detox the organs, obviously, but also help to be able to like strengthen and just give support to, whether it's the liver or the ovaries that you're doing the castor oil on. We also will use a lot of binders to help to bind out the virus. I also will use viral immune support stuff that I've used with Epstein-Barr virus. So I use a lot of like Beyond Balance for that, and their different herbs and whatnot. And then also I've used a lot of quercetin. And so using a lot of quercetin just to be able to help the immune system clear. And so quercetin, vitamin C, and then I'll use zinc. I don't go crazy on zinc, but just the things to help to boost the immune system at the same time too.
So it sounds like anything that activates the immune system, which is potentially a driver of inflammation, has a massive impact on the hormones. What is the connection points there that you see between immune activation, inflammation, oxidative stress, and what it does to patterns within hormones? Because that's an interesting thought right now.
So really, when you look at it, we have three compensatory systems. We have our immune system that compensates, we have our nervous system that compensates, and we have our hormone system that compensates. There's no doubt that all three of those talk to each other, and they talk to each other through these neuroendocrine peptides. And so when you now hear, and we do some peptide therapy, but when you talk about the peptide in that peptide world, what that is that those are those little strings of amino acids and peptides that talk so that the immune system is constantly talking to the hormone system and the nervous system. And so that they know when there is balance, that the nervous system can be calm, the immune system doesn't have to be on high alert, and the hormones can do their thing and not feel like they have to balance everything out and try to take control. And so it really is important when we put all this together that we look to make sure that inflammation is under control, that the immune system isn't fighting something off, whether it be COVID, Lyme disease, anything like that, and that the nervous system is balanced too. But any of them go off and the other are going to go off too.
Yeah, I could see how, under a scenario of like broad spectrum inflammation, people might go to the doctor, get their hormones balanced, or get them checked. I'm like, oh my God, I'm low on everything. And they don't realize that's a conscious decision by the body in order to make itself more able to overwhelm whatever potential threat, or the nervous system. When someone's in inflammation, they're kind of stuck in some weird sympathetic adrenal, dance where their body is always in a high alert fight or flight and their central nervous system's on override. And again, if hormones are to be made under optimal conditions, you need energy to allow the organism to be healthy. And if it's not, you're going to see all these compensation patterns. And for the vast majority of people who get a blood panel done, they're just going to be thinking there's something broken or something wrong with them. And I could see how they can go from person to person to person and never necessarily see the entire picture of the story.
Well, and I don't know, I've said this to a lot of people. I don't know if I'm seeing more complex cases because, when you're around longer, you just start to attract people who are a little bit more complex. Or if honestly, I think there obviously has been a lot more illness in the world and a lot more people coming in the functional medicine route because they're not getting the answers in traditional medicine. But one of the things that I for sure see is that when the body has been stressed at a high level, whether that's immune dysfunction, inflammation, or something else going on underlying, or, mitochondrial dysfunction, that one of the first things that sort of then goes low for a reason is hormones. But until you can really help to support the hormones, and the hormones, including the adrenal glands and the cortisol, and that cortisol curve that we should have every day, it's hard to get movement and to move the needle over here at the problem, whether that problem be physical, chemical, or emotional. And so it is really interesting how another reason I love hormones is because even if it's not the primary reason, when you can really go in and say, okay, if we can do a little bit of balance here or here, then we can start to also be able to get some traction in the care for all the other things that are not working right because of dysfunction.
What's so encouraging about hormones too is because they're such powerful biological signal modulators. When you make an improvement in someone's profile, it's going to be felt dramatically. It's
Mhm.
not like a slight micronutrient deficiency where they're not going to necessarily feel that, or maybe you're working on doing some digestive recalibration, if you will, and it takes a little bit of time for them to see the payoff of their investment. If your hormones are out of whack and you get them balanced, you're going to notice a massive difference in your well-being.
I joke around that there's some things I do that make instant friends. And progesterone is my instant friend one. Like when a woman is low on progesterone, and you can almost see this in so many women that, progesterone is an agonist to GABA. And so that's why it's so calming, is because it helps GABA. And so as we naturally age, we obviously go down on progesterone. And then you start to see these women as they get older that they have to drink a glass of wine to go to bed. Well, that's because the wine is also helping to bring in the GABA, but temporarily. So they might fall asleep, but they don't sleep very well. They're usually always, there's a component of it that it's progesterone. So you give them progesterone, whether that's an over the counter cream or to do a bioidentical compounding. But then all of a sudden they're like, oh my gosh, like I wasn't sleeping before, because they might even think, oh, I was sort of sleeping because I was falling asleep, but waking up 6 times a night. But it's really interesting because you do make huge differences when you do hormones right.
Absolutely. Where does testosterone fit into this whole puzzle?
Well, when you look at the testosterone really is a hormone, whether for men or women, that just wants to be left alone, is what I say. In fact, that men, they'll push their obviously hormone pathway to testosterone, but all testosterone wants is a clear sort of runway for takeoff. Like it just wants to make sure that, there's enough progesterone coming in, that the adrenals aren't going to interfere with it, and that then, through the DHEA pathway, that it just will go to that testosterone. Because it aromatizes too from estrogen, it doesn't want the interference of high levels of estrogen and like, foreign estrogens and environmental estrogens to interfere. Because then when it does, through either plastics or, there's a lot of skincare products, our water can have estrogen in it, things like that, that when there's interference, then testosterone in men will really start to decrease. Also weight and that component and being toxic also will interfere with testosterone. With women, we want testosterone. It's just that we will push more testosterone to estrogen. And so testosterone is actually a great marker on both men and women to see how messed up this whole communication is. Because when you really start to see imbalances then in a woman with testosterone, either they're depleted throughout or that whole hormone pathway is interfered with because of the fact that a woman can't find that right balance between testosterone and estrogen.
Yeah, it's as well said. I mean, I would imagine the patterns these days are, men's testosterone levels are dropping faster than a ball, off a cliff. And in some cases, women either have low or sometimes they're pushing it high in scenarios. Do you have any insights as to what's driving a lot of that dysregulation?
Well, a lot. So I think it's two main things is the environment, talking about lifestyle. I love to talk about what we can do to help decrease our estrogen exposure, from personal skincare products to making sure to take out plastics. Even receipts have estrogen in them. And so there's obviously like the environmental component of it. Sometimes men don't even realize how much they're working with plastics because certain jobs, like, you're actually like can be dealing with plastic tarps or plastic. I have a gentleman who puts up tents and he has really low testosterone. And I'm like, I honestly, think it's the plastic tents because he's touching them all the time in the heat in the
Even just
summer.
from topical exposure
What
or
we touch, it's into our skin really
yeah.
easily.
Wow.
And it's crazy to me because when you really start to get into some of this stuff, like they are putting things in like skincare products that they know are bad for us, and they're meant to be absorbed easily. And they have parabens and phthalates and triclosan and all this stuff in it that interferes with our detoxification pathways, our hormone mimickers. Some of them even were infertility, like phthalates started out as like research for infertility. And so I hate to be this like, person that's like doom, not, I always say it's not doom and gloom, but I always hate that going into some of these things, you just realize that the cards are stacked against us. But it's empowering then to know what you can do and to change. But it's death by 1,000 cuts out there. And the fact that there are so many assaults on a daily basis from what we're putting on our skin. And a lot of times we think that doesn't matter or what we're coming into contact with. But the truth of the matter is that all of it does make a difference.
But it's so easy. You just lower the reference ranges for the normal, and then you've solved your problem, right?
Yeah, I mean, nobody has any issues then. We've just solved
joking
all
aside, it only becomes awkward when you have to do it again 10 to 15 years later because
yeah.
it faster than you predicted. But I mean, that's such an important aspect to consider, because our organism, the beautifully designed thing that is the human body, was meant to manage the internal chemical stresses of us, meaning what we created for ourselves. And that's what detox pathways and the various organs of detoxification and digestion are meant to deal with. And what we have done in our, last 100 years of industrialization has introduced so many, Trojan horses into our environment to the point where I don't know that we actually even know all the ways that different chemicals can become endocrine disruptors. In the term, the disappearing male has been kind of popularized. So there are certain compounds that can immediately, within a generation, alter the gender specificity of certain animals with high quantities of exposure that is actually still below the threshold of what's allowed in, say, drinking water in municipalities.
Yeah.
So it's terrifying. And I love that we've kind of gone down the sex hormone pathway. What about peptide hormones? What about like growth hormone and melatonin and thyroid? Yeah. The ones that we don't think about those other than thyroid when we talk about hormones instinctively.
Well, one thing I did want to say too is the other thing to remember about estrogen and testosterone is insulin. So insulin is sort of a tricky little guy in the fact that he really plays a role in the estrogen to testosterone conversion. And so when we have higher levels of insulin, and you can have a normal blood sugar, but you can be in insulin resistance. But when you start to get into insulin resistance, men will start to take their testosterone and make it more estrogen, so aromatize it into estrogen, and women will take their estrogen and make it more into testosterone. And so, in that whole conversation, we also, I definitely want to, plug in the fact that you've got to look at, weight management, insulin, eating too, and being able to control, those things through like dietary and lifestyle changes. Because unfortunately, if insulin isn't controlled, it's got a mean thing where it'll make women more masculine and men more feminine. So
man, insulin's reckless.
It is. It's
gotta be careful.
It's a little bugger.
no going to 7-Eleven and getting a big gulp.
No.
Just corn syrup. It's way lower in its impact on your blood sugar.
Yeah. And all you got to do to tell a man is that next time he wants a big gulp, that he's just pouring estrogen into his body. So
here's another one. Tell people, you want to become, overweight and estrogenic as a man, drink a 2-4. That'll do it quite well. But it's interesting you say that because, I had one of the people I mentored under, he did some interventional endocrinology, and he always said, Roland, remember your anabolic catabolic pathways. They move as a network. So your testosterone, estrogen, your insulin, and your growth hormone, those are your anabolics, and you have your thyroid hormone, your progesterone, your melatonin, and your cortisol, those are your catabolics. And if that throws itself out of whack, it's the interrelationship between those that drives a lot of these aberrant pathways. And I've never forgotten that, because you just kind of reminded us with a perfect example. Estrogen can influence other pathways based upon its relationship to not only your physiology, but what it does to those hormones when the pattern is consistent enough.
Yeah, no, and it's I always tell people it's a nicely tuned orchestra. And even though there seems like there's so many parts, you don't want the flutes doing the waltz and you don't want the tubas, playing a hip hop, because that's when then things are just going to feel so out of sorts for you as a person. But you just got to get them all orchestrated on the same page. And with that segue, one of the big things that is part of the orchestra is peptides. And
Mm.
so when you look at what helps to be able to guide this whole dance, it's really peptides. And so, growth hormone obviously has been on our radar for a long time. Obviously, unless you're very specifically like a young individual that's not growing right, we don't want to give somebody growth hormone because there's a lot of side effects and problems with that. But there are peptides, that are available, like sermolins and ipamorelins, that are growth hormone supporters. And so they'll help to support somebody making their own growth hormone. So when we get into this peptide talk and peptides in general, the nice thing about peptides, and something else I'd love to talk about, which isn't as well known, as bioregulators. But peptides and bioregulators really help to get everything back on the same page, because they're really about the communication. So some of the work that a lot of people reference, like Bruce Lipton and Candace Pert, and individuals that have really talked about how all these hormones and neurotransmitters are connected, and the immune system's connected, and the neuroendocrine immune system, all of that comes back to how they communicate through the peptide systems. And so then when we're able to do some support for peptides and whatnot, then that's where we can then get everything on board. And another piece that I think is so important is enzymes. Because the other thing that so many people don't realize is so many of us are enzyme deficient. And so if we don't have those right enzymes, then we can't have these pathways that'll make the peptides and the pathways that'll communicate to the hormones and the nervous system. And so even just getting somebody's enzymes and putting them on an enzyme like nattokinase, serrapeptidase, those kind of things makes such a big difference, because it helps at cellular communication.
I mean, you just literally walked into the perfect segue for me, because US enzymes is kind of their jam.
Yeah.
Bravo, well done. That was effortless. I wanted to ask then, when it comes to utilizing enzymes in the context of hormone therapy, what are some of the best practices that you found success with?
Yeah. So, I mean, I think you need to just give them back enzyme support, because you really do want to support, not only the systems, but you want to get to the cellular level. Like, you want to get their cellular support back. And when you look at what enzymes do, and the fact that I believe as we age now, almost all of us are enzyme deficient, because our food just doesn't have enzymes in it. I
Mhm.
mean, I was throwing out fruit the other day, and I had an apple that was in my fridge that I could have still eaten, and I was like, I got this 2 weeks ago. Like,
That's a problem.
yeah, like,
It
and
should
I mean, I
oxidize
buy,
and then you start biting into it.
yeah, like I buy like out of the organic section, but especially here in Minnesota, I mean, I realized too that we probably get a lot less enzymes, because it's hard to get, local fruit now, and, end of fall and winter. But, with that being said, I mean, the truth of the matter is that we don't have these enzymes in a lot of our food, which is where it should be. And then when you talk about stress, and like I said, physical, chemical, or emotional stress, that depletes our enzymes and our nutrients. But it's the enzymes that are going to be able, they're these little like workers that are necessary for, cleanup, repair, and communication. And, the Germans love their enzymes. The first enzyme I ever used was Wobazyme, and I was shocked by how better people would get, 20 years ago. Now, obviously, we can be a lot more focused with our enzyme therapy. So, whether it has nattokinase, serrapeptidase, any of those enzymes, it's just, I find that whenever you really want to get things working and get the enzymes right, then everything else can build from there.
Yeah, I mean,
I mean, all their products, all your guys' products, I mean, you've put the science into them.
I mean, we definitely try. It's about efficacy, first and foremost, and it's about understanding how these things are impacting the whole system. I mean, we talked about inflammation and how inflammation imparts shifts in different aspects of different body systems. And one of the best ways of resolving inflammation with almost no collateral damage is assisting the immune system with enzyme support. And, on top of that, it can segue into something else, because when you talk about hormones, like sex hormones are cholesterol derivatives, right? So they're fatty substances. Peptide hormones are protein derivatives. They're amino acid based. And what kind of an impact do you think it has on someone's endocrine, their hormone production side, when their digestion isn't working properly?
So a lot of things is, first of all, then, when their digestion's not working right, then, you start to get that vagus nerve involvement. Now, here, I think, just a very basic concept is you're going to have two choices then when you're in more of a, like, well, you have fight or flight, or you have rest and digest. when your rest and digest and your digestion is inflammation based, you're in fight or flight all the time. You're not getting that I'm calm, I'm cool, I'm collected, and I'm digesting food. You're just in this constant state of inflammation because every time you digest, it's an inflammatory process. With that being said, then when you start to get into this fight or flight, reproduction to our body is not a necessity. And so our hormones go completely out of whack, and our desire to reproduce and our hormone balance will go off when there is inflammation. And there can be humongous amounts of inflammation. And it's crazy to me because that inflammation can sometimes even be almost silent to people in the gut. And when there is that amount of inflammation, then your hormones are going to try to compensate again day to day because they're getting a lot of their information from 70% of the immune system that's in the gut, that second brain that is the gut. And they're just going to be completely out of whack when your hormones are up. So there's a lot of women that come in, especially younger women, that come in with hormone issues, and it's stemming from the digestive system in the gut, whether it be an imbalance of good versus bad bacteria, or whether or not, their secretory IgA is off because of the fact that they're having immune responses in their gut. But when we fix that and we get that immune system balance, then the hormones will start to balance too.
Yeah, you did mention that like a fungal overgrowth. I believe the technical term for fungal is infestation, not infection. But when you have an infestation of excessive fungus, you can see issues with the endocrine system being imbalanced. What are some strategies that you guys employ at the clinic on the digestive side when there are known endocrine issues, be it production or detoxification? And what are some of the outcomes you see just by fixing digestion, if you have any of those stories that you can tell?
Mhm. So interesting enough to, I've started, well, I guess it's been probably about 7 or 8 years, but doing more parasite cleanses with patients. I don't think that they show up a lot in the testing, but I think a lot of parasites, almost like infestations, actually end up in the reproductive tissues, because I do get a lot of women that we will do parasite cleanses with, and they will start to see odd things coming out through, menstrual blood that look
Really?
more parasitic. So I'll see them a lot of times, certain women, when we do parasite cleanses, even though we're targeting the gut where we think the parasites are, we'll see things come out in the urine. We'll see things come out definitely in the reproductive. We'll see a lot more mucus throughout the cycle. But then when they shed and bleed, there are things that they've never seen before, and definitely things that look more parasitic in nature. Um, the microbiome part of it too, like when, we can check the microbiome in the gut, but if it's off in the gut, it's off in the whole body. And the reproductive tissues are mucous membranes, and they're mucous organs. I think sometimes we forget that, like the ovary is a huge mucus organ. And so, each month what it's doing is producing an egg, a mucus membrane that is covering a ovum. And so when you look at that, then the microbiome and any kind of bacteria that can be in the gut, a lot of times also there'll be imbalances then in the ovaries. And a lot of women with endometriosis, a lot of women with cysts on their ovaries or fibroids, I find they actually are connected to either yeast or parasites.
So is it like a concept of maybe leaky gut and something translocating from one mucosal lining to another? And the
And
second part of
we,
that question is, does the ovary have its own microbiome? Is it sterile or
so
not?
so women's reproductive organs tend to be very dependent on lactobacillus, and so obviously in the vaginal canal. But when you look at in general, like we have microbiome throughout our whole body, and we're outnumbered. Our cells are to the microbiome, and so when we look at it and then put it all together, that the microbiome, the bladder, the reproductive organs are very dependent on a good microbiome. And with the reproductive tissues, we know that lactobacillus is a big one for reproductive health. And I can't tell you how many women with endometriosis, like I said, I mean, we've just put them on a cleanse and have started to see improvements. And so even though the unfortunate thing about talking about both candida and parasites is there's not great tests out there. I find them that they get missed a ton. Like for instance, I'll think, oh, this woman has candida or this person might have parasites, and I'll do a test and we don't find them. But then, we'll do a cleanse and see a lot of change, and we'll see things come out of their body that don't look like they should be there. So I know there's a little bit of controversy, but yeah. So, but it just goes to show too, and talking about what we did a little bit earlier, our microbiome has been under huge assault. And so when you look at like all the things in our environment that kill off our microbiome, from antibiotics to antibacterial, soaps, antibacterial hand washes, hand sanitizers, all of those things. Yeah.
Bacteria, the problem, right? It's never the terrain, it's always the bug.
Exactly. And so, when you look at all of those things, that's when, it's all connected. I mean, our body just all talks to each other. I have to tell you the truth about parasites, though, is that I've done a fair amount of research. You have to really go into European research to find anything out about it, because here in the US, we just think that the only parasites you're going to get is from another country. We check our animals for parasites, but not ourselves. But Europe has actually done some great research on parasite. They actually, I read a research article a couple of years back where they believe that maybe even about 15% of cancers are actually undiagnosed parasites. So it's a very that world is a little bit harder, I think, sometimes to be in for fact-based people, where it's like, okay, I want to see this on a test and, be able to hang my hat on this. But I will tell you that from starting to do parasite cleanses and starting to, when something seems like it might be there, a connection to that, and doing the cleanses, I've seen huge changes. And so I'm a firm believer that, a lot of us are in a different realm of not necessarily like infestations where like you go to Mexico and you get Giardia, but a lot of us have had this cohabitation with either higher levels of bacteria than we should have, higher levels of yeast than we should have, higher levels of parasite, and lower levels of the good bacteria. And so there's this imbalance. And so by being able to find that balance again, then we're able to really be able to then go after and support the hormone and immune system and nervous system and make some changes.
I think that's an incredible insight. I mean, infections and infestations of all kinds, it's the terrain that we create within ourselves that allows these things to proliferate beyond their point of balance. And when they do so, they intervene and create a compromise in the natural barriers within us. Mm-hmm. And as a result of that, if things are getting in places they're not meant to be, and they find a way to stay and sustain themselves, well, it makes perfect sense as to why various illnesses may be contributed to things such as that. We just don't have the thought process, or maybe like you just said, we don't have the research that the fact-based people need to see to be convinced of that process. I mean, it's funny you say that, because I had a client I worked with a while back, and he was diagnosed with some kind of infection, or he knew something was not right with him. And he was having all these horrible symptoms being presented. He was holding literally almost a few pounds of fluid in his body. And the story doesn't end well. I just found out recently he passed away at the age of 38. And it was a kind of lymphoma with a secondary, like an immune dysfunction, where it was like hyper responding to some kind of infection. So I do believe, like I like the Germans for that. German biological medicine has traced a lot of these connections to where you have functional disturbances when there's frequency disturbances prior, and then the downstream illness is just when the body can't keep a lid on anything anymore. So I love that you mentioned that. Thank you. So I kind of want to go for it.
No, I was just going to say one thing, Cook. I mean, obviously I respect traditional medicine, but we've gotten into disease management. I mean, that's what everything is. And they're trying to make it, from being in that world, they're trying to make it easy. They don't want the provider to think. They don't want the provider to have to use critical thinking. And I think we've seen this more than ever in the last 2 years. Like, when something gets thrown at them that wasn't textbook, they don't know what to do. They're deer in headlights, because, traditional medicine is really focused on disease management. The whole thing is like, I just have to diagnose you. And once I've diagnosed you, then I know exactly what to do. And my job's done. And even to the point of like, not even maybe I have to diagnose you. I just have to come up with a hypothesis that I think it's this. If I rule it out, then I'm done. You don't have this. So, it's over. When you really look at it, though, that's not health management. That's not wellness management. And that's not getting somebody back then on the path to wellness. There is a book from John Robbins that he starts it out by saying that the way traditional medicine looks at it is we wait for you to fall off a cliff. And then we say, oh, we're so smart because we'll tell you what pushed you off the cliff. I think, obviously a lot of us like to be in the world of let's stop people from going to that cliff. But the hard part is that a lot of times we're in this uncharted water. Like I love like being able to say, okay, this is, sitting in front of someone and being like, we know this, and this is how it all fits together. But then when you start to see, and when you start to really listen to patients, I've had the privilege of having a ton of patients in my office and listening to them, you start to see these patterns. And then a lot of times you get the majority of information from just listening. And, that's where, some of the things like parasites and other things have come from, is realizing that these people weren't getting better. And then going to research out of Europe. And honestly, too, I found some great research out of Russia. But, they sort of take a different viewpoint. Both of those countries, like Russia really actually has a ton of research about longevity and life longevity and how to keep people healthy for a long period of time and what's necessary, for that. And then, especially Germany has a lot of support for how to use more energetic medicine and homeopathics. But they look at the body a lot more holistically than we do. So even though I too love, evidence-based research, the truth is that like there is sort of a flaw in the US of what our evidence-based research is trying to prove, which is how to manage diseases.
You're preaching to the choir, and it's so unfortunate because it comes back to one of the first statements you made where when you're told you have cancer, it's the luck of the draw. The body never jumps up and causes disease in itself. It's a breakdown of communication. It's a loss of self-identity. So, I mean, I hope everyone listening to this, if you're open to the ideas of looking elsewhere, I know I have a lot of Russian tech because I think their diagnostics are the absolute best. Something I use called the neural check all the time. I think if you've not looked at them, those would be wonderful for the clinic. And then the fact that you brought in energetic medicine, it's all connected. So, I mean, you guys are doing such incredible work at your facility, and I thank you for sharing everything. I kind of want to round everything out because I always like summarizing the talk and giving some takeaway actions for the providers who are listening. So we talked about the whole thing about hormone balance being an in and an out thing, right? So on the production side, what are some of the best practices, some of the things that you can encourage people in the general context, not knowing their history, not knowing what they're suffering with, but what helps the body make hormones at an adequate level reliably?
So I always start with diet. So I think really when you look at low inflammatory diet, I use this analogy or this story, I should say, all the time, which is telling people how powerful diet is. Had a woman come in to me. She was, I think, 16 weeks pregnant. They found on the ultrasound that she had a gigantic cyst on her ovary. So they then went and imaged her again at 18 weeks, and it was growing. And so they had sort of talked to her about, like if this continues to grow, then, we might have to even abort the baby because it was such a large cyst. So she came to me and, obviously one of the things that we don't like to do is a lot of intervention in pregnancy and breastfeeding women. But I said, listen, let's just put you on pretty much like a Whole30 paleo diet. Let's just take out the gluten. Let's just take out the dairy. Let's take out the sugar and let's just get you to eat clean. And I was like, you can eat as much as you want, just eat clean. And she didn't have a terrible diet, but she definitely still had gluten and dairy and sugar in her diet because this was like her first functional medicine stop. And so they then rechecked at 24 weeks and the cyst was gone. Wow. And it had never, obviously when a cyst just completely bursts, as any woman who's experienced one knows, it's very painful. So it had just absorbed. There was no fluid there. There was no signs that it looked like it had burst. It just had reabsorbed. It had gone away. So that just is to prove like how much power we have in the daily choices that we make. And nobody in this country is going to be healthy just spontaneously. Like you've got to make the choices. With that being said too, let's not forget the power of good fats. I think one of the other problems is we've been in a 40-year low fat mania. And, we really were told fats were wrong. And in that process, there's been a bunch of bad fats that have been put into our diet from, trans fats to processed fats to fried foods. And so, when you look at this and look at hormones, that first step, like you talked about, is cholesterol and fats. So get your good fats in and get your good fats in every day. Fats are not only necessary, but they're so vital to, the rebuilding of the hormones. There also is things that you can easily use, like pregnenolone is another good marker for someone who you think is just deficient, because it's that first step. Pregnenolone will turn into progesterone. So if you want to support somebody, you can sort of just start with that pregnenolone. Now, I always start at the bottom though, when I'm trying to do interventions and like clear out estrogens. You've got to go slow though. People, both men and women, when they do estrogen cleanses, they will get headaches, they will get fatigue, they will feel awful. So I'll use products with like DIM and calcium deglucarate and liver support and things like that, castor oil packs, to help to be able to sort of detox. I love sauna. I think it's completely like underutilized. It's a way that we can actually be able to mobilize things really easily. I think if anybody wants to invest in anything long-term for their health, get a sauna. Because when you look at everything that's coming at us, there are a lot of them are fat soluble toxins, and we can get those moving through saunas and through supporting like our bile system. And so I love to, give saunas as therapies, dietary changes, and then, support that way.
Amazing. And I guess to complete the whole equation here, how about on the talk side when it comes to some additional strategies? Because I would assume that people are making less, but they're also detoxifying less. Are there any other things that someone could look at implementing as a strategy to help their clients with regular hormone detoxification?
Yeah, so I do think make sure that they're pooping every day. You can't take, especially, I mean, women come in to my office all the time and they have a bowel movement every 3 days and they've had it their whole life. So it's normal. But when you look at that bile system and the stools and being able to detoxify, if you're not getting someone to be able to eliminate every day, then you're just stirring everything up. So I found castor oil packs like on the liver are very helpful for regulation. You can use magnesium oxide. That's a very good tool to use too. Also aloe is something that I'll use, or, just look at their fiber and try to slowly build up their fiber. But fiber is a great thing too, that, you've got then that insoluble fiber that's going to bind up toxins, and you've got support to be able to make sure that you have good bowel movements. And so, that those kind of things and those kind of support, I think sometimes they're not sexy things to talk about. They're not like these things that when we talk about them, but they're so important.
Yeah, and then we have a product called Cleanzyme, which is oxygenated magnesium, and we have the Sun Fiber and Sun Spectrum and True Fiber. And I swear those fibers have magical pixie dust in them. There's properties that really just do dramatically change the health of someone's stools and the overall functioning of their elimination system. So it's not sexy, you're right, but it's foundational and fundamental.
I'm not also afraid to admit that I think everybody knows this too, is that there's a difference when you have a bowel movement where you feel like you have eliminated and you feel like it is bulk and fiber and like it has released something out of your body, and how you feel after that, than when you feel like if you haven't had a bowel movement for a while or you don't have a good one. And so if you think about some of these, people who aren't going every day and they're going every, 3 to 5 days, like it's just hard to support other pathways if you're not eliminating the way you should.
It's foundational. 101 is get the bowel moving. When you said that, it made me remember this shirt that I saw one time that was just like a little human figure throwing their arms up going, "I pooped today." And I think everyone should feel like that person on that t-shirt at some
Yes,
point
exactly. So, and then I also will say one of the resources I love for my patients, which a lot of people know about, but the Yuka app, YUKA, or Think Dirty app, such a great resource because you can just download it. I'm almost 100% sure it's free. You just go and scan, and you would be shocked. Like when you scan stuff in your house, how many things, it'll give it a score for how clean it is, but how many things in it have parabens and phthalates in them and hormone mimickers. And so if you're putting something on your skin every day that's interfering, and the great news about this is research has shown that even, if you're putting on parabens on your skin every day, and we'll see it in the urine, that even taking it out for 3 days. So even, then making these choices 3 days into it, we see drastic decreases in the urine markers. And so, they're absorbed easily and they interfere, but if you take them out, you make a big difference. And so I love the, Yuka app, and I love Think Dirty because it's just very easily then you can scan the stuff, and you can scan everything from cleaning products to beauty products, and start to take out the ones that are not clean.
Yeah, practical takeaways and easy to apply things are always the best, Dr. Meaghan. I wanted to end with a quick question if I could, because we had a question pop in the chat from Hope, and
Yeah.
it allows me to also correct myself in terms of an accuracy. So she said, did you say candida? And she said infection could increase estrogen. And that's where I always have someone's voice in my head saying yeast is an infestation, bacteria and parasites are an infection. So a candida infestation, is it able to increase estrogen?
Yes. So it interferes with estrogen time and time again. And I really would say, like, start to think of every hormone problem. Like, the first thing to rule out is candida. So when you see a woman with like endometriosis or cysts, and even PCOS, think like one thing to rule out is, do you think that they have candida? And the reason is for a couple different things. Is candida loves hormones, and so that's why women have more candida issues than men. It's also why you'll see a lot of yeast problems and concerns vaginally, is because it really does love to go towards the hormones. One of the byproducts of candida is acetaldehyde, and acetaldehyde, it actually really interferes with the nervous system, and it'll create brain fog because it interferes with acetylcholine, because they're similar in the chemical world of acetaldehyde and acetylcholine. So that's why women or individuals with candida have brain fog. But then on top of that, candida also with acetaldehyde will interrupt with the same pathways and detoxifications as hormones. So it leads to a lot of times like lower progesterone, higher estrogen, and issues then to hormonal wise. So everything from hormone and cycle disruptions to, like I said, a lot of my endometriosis patients, there is an underlying candida component to it. And then yes, there is the actual hormones of, we'll see usually lower like progesterone and, you know, higher estrogens with what's happening, but you start to clear up candida and the pain and other symptoms will start to at least improve.
That's awesome. Thank you so much for that insight, and what a perfect way to end off the interview in today's talk. But Dr. Meaghan, thank you so much for being
Yeah.
here. Awesome
Yeah.
conversation. I could go for a lot longer. There's a lot of other things I could ask you on a personal interest note, but we have to respect everyone's time for today. So thank you very much. It was an absolute pleasure spending some time with you. Anything else that you have to say, by all means, feel free.
No, I just thank everybody for taking time to listen to this. I, think that we're all in this together. And so I love to like have these conversations because I think more now than ever, it's important for us to all like stay connected. So I also do have, I am on Instagram at Dr. Meaghan Kirschling. So if anybody wants to reach out to me there, they definitely can too, if they have any other questions, comments, or concerns. So.
All right. Awesome. Hopefully we'll see you sooner than later, maybe after the winter, because, I'm trying to do the anti-winter thing down here in Florida, but all the best for the holiday season. Hope you had a great Thanksgiving and a wonderful Christmas.
Well, thank you very much. And thanks for having me on.
Bye now.